Hey, future counselor, in order to pass your addiction counseling exam, you must understand what clinical supervision is. In today's video, we'll define what supervision is. We'll also discuss our professional responsibilities as addiction counselors. And lastly, we'll identify important concepts under supervision and consultation that you might see on your addiction counselor exam so you're ready on test day. If you're new here, welcome. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. I provide substance use and mental health education and trainings. I also help future counselors like you pass their license and certification exams. So make sure you are subscribed to the channel so you never miss a study video. Now that we're study partners, let's get started. By the end of this lesson, you'll be able to define clinical supervision and explain its purpose within the addiction counseling profession. We'll discuss the roles and responsibilities of both supervisors and counselors, as well as the ethical standards that guide the supervisory relationship. You'll also learn how supervision supports professional growth, skill development, client welfare, and counselor accountability. Finally, we'll review supervision concepts that commonly appear on addiction counselor certification and licensing exams so you feel more confident when answering exam questions. Let's get started by defining what clinical supervision is, and we'll explore why it's such an important part of our professional counseling practice. Consultation and supervision are professional processes that help counselors provide effective, clinical, ethical, and competent services. Through supervision, counselors receive guidance, feedback, and support from qualified supervisors to strengthen their clinical skills and professional development. Consultation involves seeking advice or expertise from colleagues, supervisors, or other professionals when faced with challenging situations or specialized client needs. Both consultation and supervision help counselors improve decision making, maintain ethical standards, and ensure that clients receive high quality care. Most importantly, consultation and supervision exist to protect clients' welfare while supporting the ongoing growth and effectiveness of the counselor. Professional responsibilities are the ongoing duties that addiction counselors have to their clients, profession, employers, and themselves. Counselors are expected to maintain ethical standards, protect client confidentiality, and provide services within their scope of competence and training. Professional responsibility also includes pursuing continuing education, staying informed about best practices, and seeking supervision or consultation when needed. Counselors have an obligation to recognize their limitations and obtain additional support when faced with situations that exceed their expertise. An often overlooked professional responsibility is self-care and professional wellness. Addiction counseling can be emotionally demanding, and counselors who neglect their own well-being may experience burnout, compassion fatigue, impaired judgment, or decreased effectiveness. Engaging in healthy self-care practices, maintaining work-life balance, and managing stress and monitoring personal wellness help counselors remain effective and ethical in their work. Remember, for your addiction counselor exams, professional responsibilities involve ethical practice, competence, ongoing learning, supervision, self-awareness, self-care, and commitment to protecting client safety. The supervision or consultation process begins when a counselor identifies a clinical, ethical, legal, or professional topic or concern that may benefit from additional guidance. The counselor gathers relevant information about the situation and seeks supervision or consultation from a qualified professional. During supervision or consultation, the counselor and supervisor review the situation, explore possible options, and discuss appropriate interventions. The goal is to improve clinical decision making, ensure ethical practice, and support positive client outcomes. After receiving feedback, the counselor implements appropriate recommendations and continues to monitor the client's progress. When required by agency policy or professional standards, the counselor should document supervision or consultation activities. This process helps counselors develop professionally while protecting the client's safety. Common supervision topics include improving clinical skills, strengthening counseling techniques, and creating effective treatment plans. Supervisors also review documentation to ensure records are accurate, objective, and compliant with legal and ethical standards. Ethical decision making, professional conduct, crisis and risk assessment, and client engagement are routinely discussed to improve the quality of care. Supervision also promotes cultural competency, encourages self care to prevent burnout, and supports ongoing professional growth through feedback, continuing education, and skill development. As you prepare for your addiction counselor exam, there are several key supervision and professional responsibility concepts you should know. First, remember that client welfare should always be the counselor's top priority. Many exam questions ask you to identify the action that best protects the client's safety, well-being, and treatment needs. You should also understand the importance of ethical practice, including confidentiality, professional boundaries, informed consent, and following established codes of conduct. Counselors are expected to work within their scope of competence and seek supervision or consultation whenever they encounter situations that exceed their training or experience. Another important exam topic is professional development. Counselors have a responsibility to pursue continuing education, maintain professional skills, and stay informed about evidence-based practices. Finally, don't overlook self-care and professional wellness. Burnout, compassion fatigue, and impaired judgment can negatively affect client care. Ethical counselors monitor their own well-being and take steps to maintain personal and professional health. For your addiction counselor exam, remember these key themes: protect client safety, follow ethical standards, seek supervision when needed, practice within your competence, maintain professionalism, and commit to ongoing growth and self-care. Before we complete our practice questions, let's review a few key supervision and consultation terms. Consultation: seeking advice, guidance, or expertise from another professional to help address a clinical, ethical, legal, or treatment-related concern. Example: a counselor is unsure how to address a client's co-occurring PTSD symptoms and consults with a trauma specialist to obtain guidance on appropriate interventions and referrals. Clinical supervision: a structured process in which a qualified supervisor provides guidance, feedback, support, and oversight to help counselors develop professional competence and provide effective, ethical client care. Example: a substance use counselor meets weekly with their clinical supervisor to review cases, discuss treatment interventions, receive feedback on documentation, and ensure ethical and effective service delivery. Administrative supervision: oversight focused on agency policies, procedures, performance expectations, productivity, documentation compliance, and job responsibilities. Example: a supervisor reviews a counselor's caseload, documentation timeliness, attendance, productivity requirements, and compliance with agency policies during a monthly performance meeting. Integrated developmental model: a supervision model that recognizes counselors progress through different stages of professional development and require varying levels of support, structure, and autonomy as their skills and confidence grow. Example: a new counselor receives frequent guidance, feedback, and direction from a supervisor, while a more experienced counselor is given greater independence and collaborates with the supervisor on complex clinical decisions. Transference: a process in which a client unconsciously redirects feelings, attitudes, or expectations from important relationships in their past onto the counselor. An example: a client begins viewing their counselor as a parental figure and reacts to the counselor with the same trust, anger, and dependency they experience in their relationship with a parent. Countertransference: a process in which a counselor unconsciously projects their own feelings, experiences, biases, or unresolved issues onto a client. An example: a counselor who experienced a difficult divorce becomes overly protective of a client going through a similar situation and begins making decisions based on personal feelings rather than the client's needs and treatment goals. Code of ethics: A set of professional principles and standards that guide counselors in making ethical decisions and providing competent, responsible, and client-centered care. Example, a counselor maintains client confidentiality, avoids dual relationships, and seeks supervision when faced with an ethical dilemma to follow professional ethical standards and protect client safety. Decision-making model, a structured process used by counselors to evaluate situations, consider ethical principles, review possible options, and determine the most appropriate course of action. An example, a counselor discovers a potential boundary issue with a client and uses an ethical decision-making model to review the situation, consult with a supervisor, consider ethical standards, evaluate possible actions, and choose the response that best protects client safety. Vicarious trauma, the emotional, psychological, and physical impact that can occur when counselors are repeatedly exposed to clients' traumatic experiences, stories, or suffering. Example, a client who regularly works with trauma survivors begins experiencing intrusive thoughts, increased anxiety, emotional exhaustion, and changes in their view of safety after hearing repeated accounts of violence and abuse. Counselor identity. A counselor's professional self-concept, including their values, ethics, knowledge, skills, responsibilities, and commitment to the counseling profession. An example, a counselor regularly engages in supervision, continuing education, self-reflection, and ethical practice to strengthen their professional identity and provide competent, client-centered care. Professional development, the ongoing process of improving knowledge, skills, competence, and effectiveness through education, training, supervision, self-reflection, and professional experience. Example, a counselor attends continuing education workshops, participates in clinical supervision, earns advanced certifications, and stays current on evidence-based practices to enhance their professional competence and better serve clients. Continuing education, ongoing learning activities that help counselors maintain, improve, and expand their professional knowledge and competence throughout their careers. Example, a counselor completes continuing education courses on trauma-informed care, ethics, and substance use treatment to maintain licensure, stay current with best practices, and improve client care. Question 1. A newly hired addiction counselor meets weekly with a qualified supervisor to review cases, receive feedback on counseling skills, discuss ethical concerns, and improve clinical competence. What is the primary purpose of clinical supervision? A. To ensure counselors meet agency productivity requirements and complete administrative tasks on time. B. To provide guidance, support, and oversight that promotes counselor development and protects client welfare. C. To allow supervisors to make treatment decisions on behalf of counselors and direct all client services. D. To evaluate counselor performance primarily for disciplinary and employment-related purposes. The correct answer is B. To provide guidance, support, and oversight that promotes counselor development and protects client welfare. B is correct because clinical supervision focuses on counselor development, skill enhancement, ethical practice, and client welfare. A is incorrect because this describes administrative supervision rather than clinical supervision. C is incorrect because supervisors provide guidance and oversight, but counselors remain responsible for their clinical work. And D is incorrect because while evaluation may occur, the primary purpose of clinical supervision is professional development and quality client care. Question 2. A counselor is working with a client who is struggling with a recent divorce. The counselor has unresolved feelings from their own divorce and begins feeling unusually protective of the client. The counselor notices they are making recommendations based on personal experiences rather than the client's treatment goals. Which supervision concept is best illustrated in this scenario? A. Transference. B. Countertransference. C, clinical consultation, or D, professional development? The correct answer is B, countertransference. B is correct because countertransference occurs when a counselor's personal feelings, experiences, or unresolved issues influence their reactions to a client and potentially affect treatment. A is incorrect because transference occurs when a client projects their feelings or expectations onto the counselor. C is incorrect because consultation involves seeking professional guidance from another provider regarding a clinical concern. And D is incorrect because professional development refers to ongoing learning and skill enhancement throughout a counselor's career. Question 3. A counselor has been working long hours, feels emotionally exhausted, has difficulty concentrating during sessions, and reports feeling detached from clients. The counselor has stopped engaging in self-care activities and is beginning to question their effectiveness as a professional. What is the most likely concern in this scenario? A, countertransference. B, professional development. C, burnout. Or D, clinical supervision. The correct answer is C, burnout. C is correct because burnout is characterized by emotional exhaustion, reduced effectiveness, detachment, decreased motivation, and chronic work-related stress. A is incorrect because countertransference involves a counselor's personal feelings or experiences influencing their reactions to a client. B is incorrect because professional development focuses on improving knowledge, skills, and competence through training and experience. And D is incorrect because clinical supervision is a process that provides guidance, support, and oversight to counselors. Question 4. A counselor attends workshops on ethics, completes training on trauma-informed care, and participates in courses related to substance use treatment to maintain licensure and improve clinical skills. What is the primary purpose of continuing education? A, to ensure counselors remain current in their knowledge, skills, and professional competence throughout their careers. B, to allow counselors to transfer responsibility for difficult cases to more experienced professionals. C, to reduce the need for supervision by replacing ongoing professional guidance with formal training. Or D, to provide counselors with opportunities to specialize in areas unrelated to their current scope of practice. The correct answer is A, to ensure counselors remain current in their knowledge, skills, and professional competence throughout their career. A is correct because continuing education helps counselors maintain their competence, stay informed about best practices, fulfill licensure requirements, and improve client care. B is incorrect because continuing education does not transfer responsibility for client care to others. C is incorrect because training supplements but does not replace supervision, consultation, or professional support. And D is incorrect because while counselors may learn about new specialty areas, the primary purpose is maintaining and enhancing professional competence. Question 5. A substance use counselor is working with a client who reports symptoms that may indicate a complex eating disorder. The counselor has limited training in eating disorders and is unsure how to proceed. What is the most appropriate action? A, continue treating the eating disorder symptoms independently because the client is already receiving counseling services. B, delay addressing the concern until additional symptoms develop and diagnosis becomes more apparent. C, seek supervision or consultation and determine whether a referral to a qualified specialist is needed. Or D, provide recommendations based on personal experience while focusing primarily on the client's substance use concerns. The correct answer is C. C is correct because when counselors are uncertain about a clinical issue or encounter concerns outside their expertise, they should seek supervision or consultation and consider an appropriate referral. A is incorrect because counselors should not provide services that exceed their competence, training, or scope of practice. B is incorrect because delaying intervention may prevent the client from receiving timely and appropriate care. And D is incorrect because personal experiences do not replace professional training, competence, or supervision. Question 6. A counselor is preparing to use a new intervention with a client, but is unsure whether the approach is appropriate for the client's needs and stage of recovery. The counselor decides to discuss the intervention with the supervisor before implementing it. What is the primary reason for seeking supervision in this situation? A. To transfer responsibility for treatment decisions from the counselor to the supervisor. B. To obtain clarification and professional guidance regarding the appropriate use of the intervention. C. To ensure the intervention complies with agency productivity requirements and documentation standards. Or D. To allow the supervisor to determine whether the client should remain in treatment or be discharged. The correct answer is B. B is correct because supervision provides guidance, feedback, and support to help counselors make informed clinical decisions and provide effective client care. A is incorrect because counselors remain responsible for their clinical decisions even when receiving supervision. C is incorrect because while supervision may address documentation and agency requirements, the primary concern in this scenario is clinical decision making. And D is incorrect because the issue involves selecting an intervention, not determining treatment continuation or discharge. Question 7. A counselor is interested in earning a certification in trauma-informed care, but is unsure whether the credential would be beneficial for their professional goals. The counselor discusses the opportunity with a supervisor to gain guidance and explore potential benefits. What is the primary purpose of seeking supervision in this situation? A. To obtain approval before pursuing any additional education or professional training opportunities. B. To receive career guidance and support related to professional development and the future growth opportunities. C. To determine whether the certification is required to continue providing counseling services to current clients. Or D. To transfer responsibility for career planning decisions to a more experienced professional. The correct answer is B. B is correct because supervision can support professional growth by helping counselors explore career goals, training opportunities, certifications, and areas for skill development. A is incorrect because supervisors may provide input, but counselors do not typically need approval to pursue professional development opportunities. C is incorrect because the scenario does not indicate that the certification is required for current practice. And D is incorrect because supervisors provide guidance, but counselors remain responsible for their own career decisions. Question 8. A counselor notices that their caseload has increased significantly over the past month. As a result, documentation is falling behind, client follow-up is becoming inconsistent, and the counselor is concerned that the quality of services may be affected. What is the most appropriate action? A. Discuss the workload concerns with a supervisor and seek guidance to ensure client care and professional responsibilities are maintained. B. Continue accepting additional clients because meeting agency demands should take priority over concerns about workload. C. Focus on clients with the most severe needs and temporarily postpone documentation and follow-up activities. Or D. Reduce the length of counseling sessions without informing clients to accommodate the larger caseload. The correct answer is A. A is correct because counselors have a professional responsibility to recognize when workload may affect client care and seek supervision to address concerns appropriately. B is incorrect because client safety should not be compromised by excessive workload demands. C is incorrect because documentation and follow-up are essential professional responsibilities and should not be neglected. And D is incorrect because reducing services without transparency may negatively impact treatment and is not an appropriate solution. Question 9. A counselor is working with a client who presents with a combination of substance use issues, chronic pain, and symptoms that may indicate a complex medical condition. The counselor is unaware how these concerns may affect treatment and decides to seek input from another professional. What is the primary purpose of consultation in this situation? A. To transfer responsibility for the client's treatment to another professional with specialized expertise. B. To obtain guidance and expertise that will assist in making informed clinical decisions and supporting client care. C. To determine whether the client should discontinue counseling services until the medical concerns have been resolved. Or D. To allow another professional to assume responsibility for treatment planning and future clinical interventions. The correct answer is B. B is correct because consultation allows counselors to seek advice, expertise, and guidance when faced with a complex clinical, ethical, legal, or treatment-related concerns. A is incorrect because consultation does not transfer responsibility for the client to another professional. C is incorrect because consultation is intended to improve decision-making, not delay treatment unnecessarily. And D is incorrect because the counselor remains responsible for treatment planning and service delivery even after receiving consultation. Question 10. A counselor's professional license is due for renewal in 3 months. The counselor has not yet completed the required continuing education hours, but plans to continue seeing clients while working towards the requirement. What is the most appropriate action? A. Continue providing services because the renewal deadline has not yet passed and the hours can be completed later. B. Request that clients sign informed consents acknowledging that continuing education requirements have not been completed. C. Review licensure requirements, complete the necessary continuing education, and ensure all renewal obligations are met before the license expires. Or D. Ask a supervisor to assume responsibility for any services provided after the license renewal deadline if requirements remain incomplete. The correct answer is C. C is correct because maintaining licensure is a professional responsibility. Counselors must complete continuing education requirements and ensure their credentials remain active and in good standing. A is incorrect because counselors are responsible for maintaining licensure requirements and should not delay required renewal activities. B is incorrect because client consent does not replace professional licensure requirements. And D is incorrect because licensure responsibilities cannot be transferred to a supervisor or another professional. Make sure you're subscribed so you never miss a weekly study video. For additional study resources, ways to support this channel, and for the full 12 core function counselor playlist, the links will be in the description.